Hi, this is Dr. Sudeep Roy, board-certified facial plastic surgeon here at Refine Dermatology. This video will briefly overview brow lifting procedures that are offered here in the practice. The aging brow is one of the first signs of aging in the face. Generally speaking, patients who come into the practice seeking a brow lift are concerned about heavy eyelids, just a droopy brow, appearing sadder than they actually are. And so the brow lift procedure is a very nice procedure that can be performed either in the office or in an outpatient surgical center to help rejuvenate the appearance of the brows. Brow lifting has several different approaches. There are only a few that are more popularly used nowadays. In fact, back in the day, brow lifting was performed more than it needed to be, and we have a lot of residual post effects from previous brow lifts, especially using the coronal brow lift incisions that span from ear to ear. Nowadays, in my practice, I am doing fewer brow lifts than I used to do, and this is really because I have found that the lifting of the brows can oftentimes be unnecessary. And if there is a brow lift need that is identified, it's usually related to the lateral portion of the brow and not the medial portion of the brow, as this portion of the brow is never really meant to be above the bony rim of the orbit. So in my practice, I perform a limited lateral brow lift, which is essentially a procedure to help elevate the lateral brow. In females, the lateral brow is supposed to be a little high arching in this portion right here, whereas for males, the brow position should be a little bit more flatter in configuration. Incisions involved are right here in the hairline, behind the hairline, and so heal up beautifully without being seen. And it is about an hour and a half procedure, both in the office under local anesthesia and oral sedation, or at the outpatient surgical center with IV sedation. The brow lift procedure is oftentimes performed in addition to other procedures such as lid lifting procedures or face lifting or neck lifting procedures as an adjunct for full facial rejuvenation. Social recovery from a brow lift is generally about 7 to 10 days as far as how long the bruising and the swelling around the area last. Activity restrictions are enforced for about 2 weeks, after which point most patients can resume low impact activities such as exercising, running, heavy lifting, as well as air travel.